What is the correct way to take Hpyolori ulcer meds? When it comes to treating Helicobacter pylori infections, which can lead to peptic ulcers, it's important to follow a specific approach to medication. This treatment typically involves a combination of at least 2 different antibiotics along with acid-suppressing medications, commonly known as proton pump inhibitors. This combination is effective in eradicating the bacteria and preventing antibiotic resistance. First, let's talk about combination therapy. The standard treatment usually includes 2 antibiotics and a proton pump inhibitor. Common antibiotics prescribed are amoxicillin, clarithromycin, metronidazole, or tetracycline. The choice of antibiotics may depend on local resistance patterns. Sometimes, bismuth subsalicylate is added to protect the stomach lining and enhance the effectiveness of the treatment. Next, it's crucial to follow the prescribed dosage and duration. Typically, the treatment lasts between 10 to 14 days. It's essential to take all medications exactly as instructed, which often means taking them twice or 4 times daily. Skipping doses can hinder the treatment's effectiveness. Timing is also important. Many proton pump inhibitors and antibiotics are best taken on an empty stomach or before meals to ensure optimal absorption. However, always follow the specific instructions given by your healthcare provider or pharmacist. Another key point is to avoid self-adjusting your medication or stopping early. Even if you start feeling better quickly, it's vital to complete the full course of treatment. This helps prevent treatment failure and reduces the risk of developing antibiotic resistance. After finishing the treatment, follow-up testing is recommended. This usually involves a urea breath test or stool antigen test at least for weeks later to confirm that the H. pylori infection has been eradicated. It's also important to consider local antibiotic resistance. In areas where there is high resistance to clarithromycin, a bismuth quadruple therapy may be preferred. This includes a proton pump inhibitor, bismuth, tetracycline, and metronidazole for 14 days. Clarithromycin triple therapy should only be used if testing confirms that the bacteria are still sensitive to it. Lastly, always consult your healthcare provider for personalized medical advice. This is especially important if you have allergies, have experienced treatment failures in the past, or have other health conditions. In summary, the correct way to take H. pylori ulcer medications involves adhering to a prescribed multi-drug regimen, taking the medications at the right times, completing the full course, and following up with your healthcare provider to ensure successful treatment and healing of the ulcer.